Are postural changes foundation for successful somatic rehabilitation and work of massage therapists? My name is Dr. Ostruchininov. I am founder of the Science of Massage Institute located in Phoenix, Arizona. In this short video, we will discuss critically important subject, value of postural change and examination of postural change, and how much these changes actually important for the therapist performance. The goal of this video to set record straight. From what perspective? You see countless classes and teachings which emphasize that therapists need to analyze postural changes in the patient and then use this analysis as a foundation for entire treatment session. And that is critically wrong, because the postural changes are consequence, not the problem, and addressing the consequence will never deliver stable clinical result. And I understand how maybe controversial it sounds, because generation of the therapists educated on the critical value of postural examination, and it has great value for the therapist. However, look at that from the real clinical perspective and expertise. Let's say that patient has pain in the neck, which actually created headache, and this headache is debilitating. What you see right now on the screen, picture of our patient who suffered with severe headache, and you can see on the picture that he is tilting his head backward and pushes his shoulder backward. Why he's doing that? Now the therapists who worked on him before target his inappropriate position of the shoulders and try to change that, and that in hope to relieve his headache. But the point of everything, that what you see is the postural reaction of the brain to the chronic bombardment sensory cortex by nociceptors, and that comes from his suboccipital space. From that perspective, let's put ourselves in the shoes of the patient's brain. Brain cannot give medication. It cannot give surgery. The only what brain can do is to create roadblocks and prevent additional damage and additional bombardment of the sensory cortex by changing postural arrangement. That's why he tilts his head back. It decreases compression of occipital nerves in the suboccipital space, and by pushing his shoulder back, he decreases pressure on the middle back where the rhomboids and trapezius are. If the patient right now worked in the decreased tension within trapezius or try to help with his shoulder rotation forward, he or she fights with secondarily postural reactions which brain uses to decompress and decrease amount of discomfort and pain which comes into the brain. So from that perspective, if therapist is not offering any substitute to the compensatory reaction, it leaves patient in more pain and discomfort. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you, and see you in the future. Here is another example. You see our patient with pain in the left neck and left arm, and you can see her elevation of the left shoulder. And she come to us with this very unpleasant pain and dysfunction through left upper extremity. And when we examined her, she also exhibited anterior rotation of the pelvis on the left side, and you can see that also on your screen right now. And the therapist and chiropractor who examined her point as the anterior rotation of the pelvis is the cause of her upper shoulder dysfunction. However, in reality, it wasn't the cause of your dysfunction. It was postural change brain used to decompress your upper body and the left shoulder and left neck and decrease amount of nociceptors activation which send to the brain and alter function of the brain. So brain in such case uses these roadblocks to change posture for one particular reason. It protects itself. If you have lower back and you start to limp, you did not make conscious decision, I'm starting to limp this morning. You start to do it without conscious decision. Who made this conscious decision? There is someone else pushed you to make first step with the limp. This someone will change postural change and will create compensatory reaction. What you see right now on the screen is the same patient with left upper arm and shoulder pain after her successful therapy. We eliminate clinical picture on the left arm and shoulder because the reason for all her pain was irritation of brachial plexus by anterior scalenus muscle. We didn't touch her left pelvis, and you can clearly see that her pelvis right now in the normal position compared to the right. So we eliminate anterior rotation of the left pelvis just because we decompress and eliminate symptoms on the neck and left shoulder by decompressing anterior neck. So in such case, who restore position of her pelvis? Her own brain. It change postural reaction and remove roadblocks, and that eliminated secondary reaction in the form of anterior tilt to the pelvis. And these countless examples we can provide our viewers with the same basic idea. Postural change is critically important for evaluation to detect what the changes are and find a real trigger. When you find the real trigger based on the data of the postural change, then you can deliver stable clinical result. If you start to change postural changes without detecting trigger, which can be in completely different part of the body, then you deliver only partial outcome. Our patient with anterior scalenus muscle syndrome did not complain to anyone about discomfort on anterior neck. She complained about pain and dysfunction in the left upper shoulder and arm. She didn't complain anyone about anterior rotation of the pelvis. That all of this are compensatory reaction to the fact that her brachial plexus was mildly irritated by the anterior scalenus muscle. You find the trigger, you squeeze and suffocate the trigger, then brain will remove protective reactions in the form of postural changes. And that is beauty of somatic rehabilitation. What do you think about postural change? Are they primal change or they a consequence of some other triggers which directly responsible for the clinical symptoms? Leave your comments and we will happy to start productive discussion. Let's work together to bring your practice to the new level of medical massage expertise. Thank you for watching.